making no progress. The Unite Union boss tells Sky News of her frustration trying to negotiate an NHS pay deal with the government.
Eve of fresh NHS strikes, a union boss tells Sky News Rishi Sunak is to blame for the failure to reach a pay settlement.
We're still in exactly the same position that we've been in for weeks. There's another strike tomorrow. There's an escalation of strikes over the coming weeks. And Rishi Sunak, I have to say, is missing in action. I don't know where he is.
It's so difficult, hearing patients complaining.
I met Kafilas and Linda on December the 15th, the first day of the nurses' strike. A month later, and nothing has changed.
I still feel dejected about the way things are going. The government is not listening. It's such a disrespect to the whole profession.
The reason why we're mostly going out strike and we talk to people is their concern for the quality of care that they're able to provide for the patients. And that hasn't changed either.
On Monday, ambulance workers from the Unite, Unison and GMB unions are striking in the escalating dispute over pay and staff. And the biggest walkout in the health services history is also looming. Nurses and ambulance staff are both set to strike on February the 6th. NHS leaders are looking at contingency plans, but there are fears services could grind to a halt. The latest data shows over 5,000 procedures and over 20,000 appointments have had to be postponed and rescheduled due to industrial action. And the longer the strikes drag on, well, more patients will be affected. Union leaders insist they want to negotiate, but think the government isn't interested in doing a deal to end their strike action.
Rishi Sunak, I have to say, is missing in action. I don't know where he is. Now, it's either that Rishi Sunak is not up to this job, that he doesn't want to come into the negotiating room and to do this deal, or there must be another reason as to why he's allowing this self-harm to happen to the NHS.
What do we want?
The government says it's committed to bringing down the 7 million strong waiting list, but health analysts warn that will not be possible unless this dispute is settled soon.
Unless these strikes are resolved, you're not going to see those waiting lists cleared, and you're going to see a deterioration in patient access to services. I don't see a sort of digging in, playing the long game strategy working here. I think the government is going to have to look at what its options are and look at what a settlement might be.
The government has described the latest strike action as hugely disappointing, and it insists a double-digit pay rise for nurses is simply not affordable. Kafilas and Linda are worried about their patients. They don't want a long, bitter dispute, but say the government has given them little choice. Ashish Joshi, Sky News.
And if you'd like to be part of a special debate on the future of the NHS next week, simply scan this QR code. It'll bring up an email form for you to apply to be part of that audience at University Hospital Coventry, where we'll be asking the question, can the NHS survive? You can also email direct, nhscrisis@sky.uk is the address, and you can watch that programme next Thursday, 7 o'clock, here on Sky News.